Of the Child and Youth Advocate released Toward a Better Tomorrow. This report looked at 7 Indigenous youth suicides and offered recommendations on what the government could do to strengthen its support for Indigenous children and their families in order to prevent tragic deaths like these in the future. The report made 12 recommendations for government to address the issues and move forward with our Indigenous communities. So to the Minister of Human Services, could you please, sir, update us on how many of the 12 recommendations have actually been implemented by your government to this point?
Honourable Minister of Human Services.
Thank you, Mr. Speaker, and thank you, Member, for the question. Our government is very concerned by the incidents of suicide in Indigenous communities, and we are committed to working closely within the government, with Indigenous leaders and community partners and federal government to make sure that we have supports and safeguards in place for Indigenous communities. My ministry is leading the coordination of implementation of those 12 recommendations along with other partners in GOA, education, health, Indigenous relations, and Alberta services.
For supplemental.
Thank you, Minister, but the Indigenous community is looking for a number, hopefully towards 12. So given that within this report, number 8 dictates the Government of Alberta should ensure that mental health programs are more accessible, holistic, and readily available for First Nations communities, and given that without a thorough and collaborative response, this issue will get worse before it gets better, to the Minister of Indigenous Relations, could you please update this House and all Albertans on the specific initiatives that your ministry is undertaking? And please, sir, what metrics are you utilizing to measure any and all successes?
Honourable Minister.
Thank you, Mr. Speaker, and thank you, Member, for the question. As I mentioned, that Human Services is coordinating the government response and working closely with education, health, Indigenous relations, and Alberta Health Services, and mental health certainly is part of that. And we have begun, the work is underway on 3 initiatives. We are in the process of developing a youth suicide prevention strategy. We are also funding research on Indigenous youth suicide, and we are also in the process of developing a cultural understanding framework. So there is work underway, and we want to assure Albertans that we will work with.
I was looking for a response from the Indigenous Relations Minister, but let's try number 3. Given that mental health is an extremely complicated issue, which fortunately is beginning to be discussed publicly, and given that youth who are suffering psychologically may not be comfortable or open when speaking with parents and caregivers, and given that the same report noted in recommendation number 6 that Alberta Education should develop and implement school-based suicide prevention programs to the Minister of Education, are programs like these actually being developed by your ministry, sir? And if so, what are the estimated implementation dates? Because every day could be another.
Honourable Minister.
Well, thank you, Mr. Speaker, and thank you very much for the question. And certainly we recognize as a government-wide the importance of having a comprehensive mental health strategy that I'm working with in conjunction with the Ministry of Health and Human Services and Indigenous Relations as well. We have been working very closely with school boards and also with ministry-wide to develop mental health strategies that can be implemented in both in the curriculum and then in support services that we have at each school. And so certainly this is an important issue.